Here we are again, faced with another variant of the COVID-19 virus, Omicron. It is scary and it's nerve-wracking that we keep going into these pandemics where the numbers are rising. Today, I will be speaking with Dr. Erica Harris from Einstein Healthcare Network to shed a little light and hopefully a little hope on this Omicron variant. Welcome to the show, Dr. Harris. The Omicron variant, how is that contracted?
The Omicron variant is contracted the same way that we contract original COVID and the Delta variant. Primarily, it's by being around others, breathing in their respiratory droplets. So someone around you does not have to be obviously sick and sneezing and coughing in your face. They can just be breathing out normally, and you kind of breathe in what they're breathing out. We believe, though, that the Omicron variant is a lot more contagious. So this means that you have to be around them for less time to contract the virus. And again, they don't have to show signs of illness. In fact, people tend to be the most contagious in the days, about 2 days before they actually become sick and in the first couple of days of their illness.
Now, if you're wearing your mask, you're okay. This is if you're unmasked, correct?
Yes. So being masked decreases your chances of getting sick. So if you think about kind of being out in a rainstorm, wearing a raincoat, you're less likely to get wet. But we've all had that experience of being out in the rain and we come in, even with a raincoat on, we've gotten wet. So it really depends on a lot of factors. How good is your raincoat? How heavy is the rain? So the best thing is to obviously not be in a rainstorm at all. But if you have to go out, you wear the best mask possible. And you do your best. The best thing is everybody being masked. So if the person who's sick is wearing a mask and you're wearing a mask and they're high quality masks, then the chances of transmitting it to somebody who is not infected is actually pretty good. And we know that the chances are really, really good. If you're wearing the best mask possible, which is really an N95 mask, your chance of getting ill is very, very low. And in a healthcare setting, I've been wearing an N95 mask from the beginning of the pandemic. And so far, I've been very, grateful that I have not gotten sick in caring for patients often who are very sick with COVID. And I've been very close to them, had very close interactions, and I've not gotten sick because of the quality of my mask.
Okay. The Omicron variant, those symptoms are very different from when the very first COVID came out and Delta, correct?
It's actually, I haven't seen a huge difference in the symptoms. What is different is what I've seen anyway is how soon people are getting sick from their time of exposure, something called the incubation period. With original COVID, we were seeing it could take anywhere from 7 to 10 days. So if let's say you went to a party or around somebody who was sick on, day one, anywhere from between day 7 and day 10, you might start to yourself get sick. With Delta, it was closer to 5 days. So after 5 days of being around somebody, you might start to get sick. What I've been seeing with Omicron is people saying, I was around somebody who I know was sick 3 days ago. Now all of a sudden I'm sick. And so it's really moved up the timeline of how soon you'll get sick. But really a lot of the symptoms are the same for people. We're getting a lot of runny noses, congestion. People feel like they have a sinus infection. Certainly coughing is a big part of what people experience. Some people say their lungs feel like they're on fire. Fevers are a big part of this. Nausea, vomiting, diarrhea, body aches. Those are a big part of it. And certainly loss of taste and smell is kind of unique to COVID. That does not happen with the flu. The other symptoms can happen with colds or flus. We don't see the loss of sense of taste and smell with a flu. So if you have that, we can guarantee you have COVID.
Now, are you seeing a lot of deaths with the Omicron variant with people who are vaccinated and unvaccinated?
What we've seen, and this is looking kind of everywhere, mainly the people that we are seeing who are getting the sickest are people that have not been vaccinated or who have had maybe an incomplete vaccination. So they've only had one vaccine. That is followed by people who are vaccinated and due for boosters, but have not had their booster shots yet. So the people that I'm not seeing come to the hospital, honestly, are the people that have been fully vaccinated and boosted. Those are generally not people who are coming to the hospital. They certainly are getting sick with Omicron, and that's what makes Omicron a little different than the other variants is that You can still get sick with COVID, even though you're vaccinated. And with other variants, that just wasn't true. We weren't seeing very many vaccinated people getting sick at all. So now you can see that it is getting past the vaccine a little bit, but you're not getting super sick. You're getting kind of a cold or flu symptoms for a couple of days. You're getting better quicker. You're not ending up in the hospital. I am still seeing people getting very sick. I am seeing people requiring oxygen. I am seeing people who end up on ventilators because they can't breathe on their own because their oxygen levels drop dangerously low. And I have not seen that in people who are fully vaccinated. It does happen on occasion. And most of the people who are having what we call these breakthrough infections that are very significant are people that have risk factors for severe disease in the first place. On average, these people are a lot older. They have a lot of chronic medical conditions. They're people that might be immune compromised, in whom the vaccine maybe didn't work as well because their immune system just can't mount up that response that you would hope to help fight the virus. And so those are the people that we talk about, even with the vaccine, need to be very careful about how they go about their lives, trying not to get sick with this virus. So overall, we are believing that this is not as severe as other types of like Delta and regular COVID have been. And in part, I think some of that's because so much of our population has either already had COVID or has been vaccinated, and that's protecting a lot of us. We're getting towards that idea of immunity, the idea that this can become kind of just a background in our population and not this horrible disease. I'm hopeful about that. But I think that we still have to look at what the numbers mean for us. We have, compared to other countries where Omicron has already come through the population, we do have less vaccinations compared to a lot of Europe. We have an older population than South Africa, where Omicron started. So it's hard to compare us to those areas. And we need a couple more weeks to really figure out, what this is going to look like. Overall, because so many people have been infected with this at one time, we are still seeing very high degrees of hospitalization. We are still hospitalizing a lot of people at a time when hospital capacities are very low. So even if it is less severe, we are absolutely seeing an impact on the healthcare system as a whole.
Okay. The Omicron variant, does it pass through the system quicker than Delta or, again, the original COVID-19?
So it doesn't, I wouldn't say it passes through the system any quicker. I think that some of for example, the CDC's guidance on shortening your quarantine time has to do with more getting people back to work so that our whole economy doesn't collapse, honestly, and recognizing when people are most contagious in the time course of their illness. Everybody is different. And it's very interesting. I've seen households where it'll be like a mother and a father and 3 children. And one kid has no symptoms, but is positive. 2 kids have minor symptoms. The father is, laid out, super sick, comes into the hospital, and the mother feels miserable. And that goes on for a couple of weeks, but is okay and doesn't need to be hospitalized. And so everybody sort of has their own time course of how long the symptoms will last for them. Most people do better after about a week. Some people take a little bit longer. And then you may have heard of something called long COVID, which is where people develop symptoms. For some people, it's almost indefinitely. There's people who have had COVID originally back in the winter and spring of 2020 who are still dealing with these kind of long symptoms. It can be anything like brain fog, decreased concentration, abdominal pain, diarrhea, dizziness, fast heart rate, these things that persist. And there are doctors now who are starting to specialize in how to treat these people who develop this long COVID. So some people never honestly fully recover from the effects of COVID infections. Most people, though, fortunately do go on to recover and do well after their infections. Like a flu, it would take you potentially a week to get better. Other people, my grandmother, my 96-year-old grandmother got COVID last winter, had, maybe a day of fever, a day of sore throat, and then was fine, after a day or two of symptoms. And she's somebody who, looking at the numbers, had a high risk of severe complications and death and did completely fine after a couple of days. So everybody's different.
Yeah. Now, I did see on CNN that they were indicating, and I don't know if it's they or they were getting it from one of the healthcare professionals, that it's okay to shorten the quarantine time for people who are asymptomatic, for those who are not showing symptoms. So has any of the guidelines been shortened for quarantine?
Yes. So basically, it's really dependent on your symptoms and if you're vaccinated. So quarantine is if you have an exposure but are not yourself ill. And if you have been vaccinated and appropriately boosted, so you may not be due for a booster, but if you are due for a booster, so if it's been within 6 months of Pfizer or Moderna or 2 months of a Johnson & Johnson vaccine, really the guidance is if you've been exposed to somebody you know has COVID, you don't have to stop your daily activities. You just have to wear a mask around others for 10 days. They also recommend testing on day 5 if that's possible. It's certainly hard to find some testing these days, but if you can, trying to test on day 5 is good. If you have either not been boosted and you're due, or you've not been vaccinated at all or had incomplete vaccination, they're recommending that you stay home for 5 days and then you continue to wear a mask for another 5 days after that. And if you can't quarantine, to just wear a mask for 10 days straight. Again, testing on day 5 if possible. If you develop symptoms at any point, though, you are supposed to test and then stay home and stay away from others and go into what's called isolation. Isolation is what you do once you are ill. And then the current recommendation, regardless of if you're vaccinated or not, it's the same for everybody. If your body is ill, you stay home for 5 days. There's a lot of confusion about this because it's based on your symptoms. And if you have no symptoms or your symptoms are getting better, you can go back to your normal activities, but you leave your mask on. So if you're around people in your house and everybody is ill as well, you don't necessarily need to mask. It's around people that are not part of your household or people that you're trying to protect from the virus, you continue to mask for at least an additional 5 days. And you have to stay home until your fever has been resolved for at least 24 hours. So if you're still having fevers, even though you may feel great, but if you're having fevers, that's a sign that your immune system is still actively fighting the virus and you need to stay away from others. This was in part due to the fact that really most of your contagiousness happens in the first days, like I said, those 2 days preceding you becoming sick, and then the first couple of days of your illness. And so the thought is that most people shed most of their contagiousness by day 5 of their illness. Certainly some people go on to continue to be contagious, which is where that mask wearing, comes in. And the CDC is relying heavily on sort of the honor system and hoping that people do what they're asked, will mask. And I think that's a big ask of us, but that is the hope. And in part because they recognized this surge that was coming with Omicron and how many of us have become sick at one time. Unlike other surges, there are so many people that are sick at a time that it could honestly collapse so many different industries. If we said, yeah, everybody has to be out for 10 to 14 days, I mean, that would honestly, there would be industries that just could not function. We've seen this already, I know, in the hospital where, a lot of nurses and doctors and techs and people in environmental services are out because of COVID. And if we were all out at one time for that long, that would be a significant problem. So it was sort of taking the least harm approach to all of what needs to happen in our society.
Okay. So the booster shot.
Yes.
So say if someone they've had their 2 shots of Moderna or Pfizer, and they go get a booster, and the only booster that's available in whatever facility is J&J. Can they take that J&J? Can we mix and match? And in the booster, is it the same ingredients that's actually in the first 2 vaccines?
Yes. So they are no longer routinely recommending the J&J. If you've had that already, they are giving the mRNA vaccines, which are the Pfizer and Moderna. So that's the first thing. And yes, you absolutely get whichever one is the most available. So, for example, my husband had Moderna for his initial series, and then we could not, he really wanted to try and keep it all the same because he trusted that he got these first 2 and he was fine. But he could not find another, Moderna appointment in a timely fashion. It would have been over a month out. So he found a Pfizer slot. He did fine with that. And that was based initially on studies that were done in other countries. Initially, we were trying to keep it the same. And then we started seeing these studies coming out of other countries where people were doing really well. They were getting good immune responses from getting these shots. There were not significant side effects. And so we decided that it was safe for people to do this and also beneficial, that more people could be reached with booster shots if we allowed them to mix and match. And so that is a safe and effective strategy for more people to get their booster shots.
Here we are again. The Omicron variant comes up. Before that comes up, it seems like we were a little safe. It seems like the numbers were down for the COVID-19 pandemic, and we were still masking. And here we are with another variant. Will the vaccines help with future variants that will pop up as well as the booster, or that's something that's just not known?
There's a good chance that the virus will continue to mutate. We saw with the SARS virus in 2003, for example, that just mutated out of existence, that it was picking up steam, it got to Canada, and then all of a sudden it just mutated and it just stopped spreading. Viruses do that all the time. In fact, we have 4 types of coronaviruses that cause minor colds. My kids have probably had all of those multiple times and have done fine with them and passed them along to me. And, I probably had them growing up as well. So it's possible and hopeful that this type of coronavirus will become just sort of in the background of our lives and not cause severe disease. That said, if it continues to be a problem and we need to continue to develop vaccines for it, what we may see we need to do with additional variants, if they are harmful variants, is that we may need to develop changes in the formulation of the vaccines to address those specific variants. And that's what we do with the flu every year. The flu vaccine changes every year in response to last year's flu virus in the Southern Hemisphere. So we do if you get your flu shot every year, you're getting a different shot to try best to be tailored to this year's flu, what we anticipate the flu will be. It's a little bit hard. It's a moving target because the flu is a virus and mutates. Every time you get the virus in your body or somebody gets the virus, it uses your body to replicate itself. It can't reproduce on its own. And so your body becomes like a factory for this. And every time it creates a new copy of itself, there's a chance for error. It's like handwriting something, there's a chance for it to, to come out with, a wrong word, a wrong letter. And that is a chance for a new mutation. Could make it weaker, could make it stronger, could make it better at infecting, could make it worse at infecting. And we hope that these mutations will end up making it weaker and more like a cold rather than stronger. And we've seen that a little bit of that with Omicron, that it's certainly more contagious. Our hope is it's less overall, less concerning for some people. I've seen it be very harmful. But overall, the hope is that it's less harmful to people. And this will allow us potentially to get to the point where pretty much most of the population is either vaccinated or has had the illness. And we can move on to a state of just background in the population where it's not such a menace.
So, and you said it's like the flu. Like sometimes I remember hearing there's a new strand of the flu. But you just go right on about your business because the flu has been around my whole lifetime. Yeah. And COVID is so new to me. Yeah. So I'm sure, I guess in about 10 or 20 years, this will be like that when I hear that on the news. Yeah. Oh, there's a new strand of COVID. Mm-hmm. Just like when I hear there's a new strand of the flu, I take it and keep going. I mean, still protecting yourself, but I guess it'll be like that in the future. Mm-hmm. Tell me something. Is there now better treatments for COVID that prevent deaths and that prevent people from being in the hospital as long as they were when we were in the beginning?
So I would say theoretically, yes to that. We have 2 new prescription drugs. They're FDA authorized. It's Paxlovid and Molnupiravir. Both of these are kind of fancy names for drugs that basically interfere with that virus replication process. So like I said, the virus has to go into your body, use your body's cells to make copies of itself. These drugs interfere with how that happens. It kind of breaks up the drug or the virus and makes it weaker as it's doing that in your body. And so it kind of works on similar models of how HIV replicates in the human body. And so it works similarly to stopping that process, but it works with COVID in the body. These have shown great results in the clinical trials that have been done, decreasing hospitalizations and deaths by close to 90%. So they're very effective in the clinical trials. The problem we have with them right now is they're in very short supply. So we don't have a huge supply of them. They've not been manufactured aggressively yet. There are only a very small handful of pharmacies that are filling these in our area. I have a list that's about a page long of pharmacies throughout the state where you can get these filled. And there's even smaller amount in this area, in the southeastern Pennsylvania area, where you can actually go to get these filled. So currently we are really saving these for people that are the super highest risk. This would be people who have received organ transplants, people with the most medical risks of developing severe disease. This is not just for anybody who gets it. This is not for the young 20-year-old with no risk factors who just doesn't want to be sick with COVID. We really have to kind of ration these medications because they are so hard to find right now. We're anticipating that sometime maybe in March that the supply will be robust and that This will help the disease move from this big, scary thing to something that is much more manageable. And so we're very excited about this. I would say, though, that honestly, what we have right now that is the most effective in preventing severe disease still remains vaccination. And for people that are the highest risk, continuing to do physical distancing when possible. I know that's not a possibility for a lot of people. People work in industries where they can't work from home and they have to be around other people. We have jobs where we care for other humans and we have to be around other humans to do that. And we have kids that we care for, and schooling is important, and our social interactions matter a lot for our mental health. And so trying to get back to being able to be around others is an important goal. And so vaccination remains kind of the mainstay of how we can do that safely for now. These drugs I look up as kind of like a backup. This is sort of like the goalie trying to stop the ball from getting into the net. It's sort of like the last line of defense, not the first. So I'm looking forward to when they're available and we can prescribe them to patients.
Okay. So last question. You have two beautiful children that attend daycare. I have two beautiful grandchildren that are attending daycare. Mm-hmm. We see on the news that a lot of the Philly schools are closed because the virus is running rampant in the schools. What can parents do to protect themselves, or family members do to protect themselves when their children have to go to school or daycare, but then they come home? What can you do to protect the household?
So the first thing I have to say is that in-person education is so important. The American Academy of Pediatrics has talked about the importance of children being around others, learning social development, learning social skills. For a lot of people, one of the hardest things about last year was widespread school shutdowns, and in-person learning is what they need. And they need access to those resources. And when you look in especially disadvantaged school districts, kids rely on things like food programs. They rely on school counselors. Parents rely on those services to be able to go to work. So when you look at it from a whole societal standpoint, this is crucial that this can function, right? This is not just kids going to school. This is an important part of the fabric of our society. So this is something we absolutely must protect. The number one thing, again, I keep going back to this, that people can do is get eligible people in the homes vaccinated. And this includes children. 5 and over can become vaccinated. My children are currently 4, and I am looking forward to in a couple months when they are old enough to be vaccinated to help protect them. But since they're too young to be vaccinated, we've created kind of a bubble around them of people who are vaccinated, so that we are doing the best that we can to avoid bringing it into the home around them. When they go to school, they are masked and everybody around them is masked. It is certainly not perfect. We understand that masking is not 100%, but it is effective. And it is effective enough that I would not send them somewhere where masking was not required. It's much harder with younger children, and we know that children under 2 cannot wear masks. But in their classroom, masking is required and it is enforced. And social distancing is virtually impossible with young children. And I know that as well, that you can't keep a bunch of, 3 and 4-year-olds from being 3 and 4-year-olds. And that's part of that socialization. So you just do your best, like, you would throughout any other cold or flu season in the middle of a daycare or a school. You talk about frequent, hand washing, and you do everything that you can. You avoid any unnecessary risks at this point. That's kind of what we're doing. Every family is different. You may have families where all of your kids are vaccinated and you don't have any high risk exposures. You're not living in a multi-generational household with older adults also that you need to be careful of, because those really are the people that are not doing as well. Even ones vaccinated, those are the ones that are having those breakthrough infections and need to be, cared for a little different. When if you have those circumstances where everybody's vaccinated and you feel safe and you want to take additional risks and have a wider social circle, that's a choice that you're free to make. It really just, I think, is an individual family, kind of family decision at this point in the pandemic. You can't live on lockdown forever. So the key, though, is to maintain what is a critical part of our society, and that is the education and social development of our children and the functioning of American families and the ability of parents to go to work and earn livings for their families. So that's something we must really, really, really defend.
Okay. Well, thank you so much for joining me today, Dr. Harris. As always, you break everything down so that everyone can understand it. Thank you so much for joining me today. Thank you for joining us today. Please remember to wear your mask And sometimes it may be necessary to double mask to make sure that you are safe. You are wearing your mask not only for your safety, but for your family member's safety, and especially for your children and the elders in your family. We will get through this together. The power of one starts with you. Thank you for joining me today.